thank you. So I have to apologize, I guess, first. I thought I had done something wrong. I was not only given the last spot in between you and the reception, but I have to give a talk after Rajavi, so I knew the challenge would be steep. But now I understand the infinite wisdom that Jerry and Larry had, so we're going to continue the leadership theme and talk a little bit about leadership development at a student level. I'm a neurologist, a neuro-oncologist, and an educator. My passion is in mentoring and leadership, and I'm going to talk with you about a program that we're doing in that last piece. We're going to talk about two things, and it's going to center around this Navigating Medical School program, and we're going to present life of a student and what the challenges that a medical student will experience in going through training, and talk about how this program is helping younger students, junior students, navigate those challenges, and think a little bit about how that program could be leveraged for early leadership and career development for those same students. So no real relevant disclosures for this talk. So these pictures may be familiar to you all. This is like the best day of medical school. This is match day. And so you see the elation of opening a match day letter, the bliss of some orthopedic surgery, future orthopedic surgeons up at the top, a lot of white coats and a lot of smiles. And that's where medical school tends to end. In many respects, it kind of starts there too. So this is 4 years prior. This is white coat ceremony day. There's still white coats. They're a little bit cleaner. There's still some smiles. They're a little more timid. And a lot happens in between those 2 points in time. And really, as we talk about burnout and stress and some of the challenges that we're facing as healthcare system, those things begin right after this white coat ceremony. And when you look at some of the challenges that a medical student may experience over the course of their medical training, some of them include things like having to match and survive through that process, selecting a medical specialty, surviving clinical rotations, standardized exams, USMLE exams, patient outcomes, good patient outcomes and poor patient outcomes, and just personal well-being. There are a lot of things, there are a lot of challenges that a medical student will experience over the course of training. And about 3 years ago, I met a third-year student who had just begun his clinical clerkships. He was young and eager. He was in the emergency department. He was diagnosing and managing disease, and his first patient came in VFib. All the resources of the emergency department descended on this patient. He completed or performed his first resuscitation and chest compressions, and the patient died. And just as quickly as all the resources descended on that patient, all the resources left and went to the next patient who needed to be cared for. And he was standing there at the bedside struggling with this process. What does he do? And how has everyone so quickly moved on to the next patient, and he's still at the last patient who was there? And this is a clinical event that medical students encounter every day. That same stress and tribulation occurs with selecting a specialty and many other things that occur in medical school. And he came to me and said, we need to fix this problem. And he developed a program. It's called the Navigating Medical School program. He was attached to many faculty mentors. He came from a great family, many physicians in his family. And he said, the people that I want to turn to in this situation are my peers. And this concept of peer-assisted learning is gaining credibility in education literature, and said, I'd like to reach out to the last student that went through this and understand how they survived that and what they went through and share my experience. And he put together a really fascinating program that has now come into fruition over the last 3 years. It's a 3-part program designed to assist students in the challenge of navigating medical school. There are 3 components to it. It starts with a seminar series, and that series are specially timed lectures and small group opportunities to talk about some of the challenges that happen in medical school. Outside of those seminars, students are paired with guides, a junior student paired with a senior student to walk through in an individualized fashion some of those things with a senior peer who has experienced those processes. And it is hovering on the outside as a professional networking platform, a social media platform that combines students and connects them with both peer and faculty mentors. Central to this Navigating Medical School program is the concept of a compass, and the goal is that every student comes in and leaves with a compass. And it is a compass that helps them to navigate school, and it starts with a faculty mentor as the North Star, driving their future career development. And to the sides are the student mentors and the peer support that arm students with the resources they need to survive through their 4 years. And hovering closely are the friends and family that help to support them through that process. And a lot of medical schools do this. This is a common resource that we see in medical training, not just in medical school, but health professions training more broadly. And for this program of the last year, as a part of the leadership development program, I wanted to bite off this concept of a guide. And this guide is the same dyad that you just heard. There is a junior student who needs to be navigated through medical school, and there's a senior student who could benefit from leadership development opportunities. And we wanted to use this Navigating Medical School program to leverage some resources to begin early leadership development for those senior students so that they not only benefited from the opportunity to be a mentor, but from formal leadership development as a student and prepare them for future practice. So the program I will describe to you parallels the GUIDES program. The GUIDES program is a peer-assisted learning program. It combines a younger student mentee with an older senior student guide. Those guides are self-selected. There's a little match day. It's like Match.com gone live. Those guides then have a series of meetings over the course of the year, and it ends with a final send-off meeting. And we attach to that formal leadership development training for the senior students. It begins with a 4-hour workshop on a Saturday. They got to show up outside of clinical work and come and learn about a strength-based approach to leadership, which many of us who went through the KIPL program will be familiar with. That then spills off later into a 1-hour seminar on authentic leadership and using those individual traits to provide leadership and mentoring to their guide in an authentic fashion. And then we had an online session, a virtual session, to cover some of the shadows and other aspects of leadership. And this was integrated into the GUIDES program. Our overall aim was to figure out, can we do this? Will students show up on a Saturday and go through this series? And if it is feasible, what's the impact to students? And particularly to the senior students in leadership development. The series involved 3 sessions. We just described those, a 4-hour workshop followed by a 60-minute small group seminar and the virtual session, which was 60 minutes thereafter. We wanted to see whether this impacted student self-awareness, a quantitative measure of how student self-awareness changed, as well as satisfaction, and look at some of the impact on students and their leadership development. What happened? We invited 30 students to participate in the program, and 24 decided to sign up. We knew many of them. We twisted their arms, we arm wrestled them, and they finally came in on a Saturday. So we had about an 80% take rate in terms of students interested in this. 18 of those students completed a pre-survey, and 16 of those students completed a post-survey. And this is what it looked like. Kind of like the KIPL program for those who have been through it. A really dynamic group of students that came together. This is our medical center on a Saturday. This is a conference room. If we weren't there, nothing would be happening. And so we were able to invade it and create a really dynamic environment for these students. And I think what they found is they enjoyed it. They were at least satisfied. We asked the students, what was your ability to self-assess? What was your insight into your strengths as a leader beforehand? Beforehand, many were below average or average, and that improved after the course. And we also asked them their ability to adapt communication style to build rapport. And again, you see a smattering of responses before the course, with many students saying that their ability to adapt communication after the course was reported as above average. Students felt like they walked away with some insights into their personal leadership qualities. We asked them if they come back and do it again, and they said yes, mostly. No student said it was not useful, do not continue this. No student said it was useful if changed substantially, and the vast majority of students said this course and the ability to think about their individual leadership traits and how they would apply this to mentoring a fellow student was useful. We asked students whether they walked away with an understanding of their strengths, weaknesses, learning about blind spots, and how relevant this was to understanding themselves and others. And suffice it to say, they felt satisfied with what we told them. And I think most importantly was some of the qualitative data that we gathered during this. And I'll take you through some student quotes. And in general, students felt that the impact of this program centered on 3 themes. The program helped them understand how to be a future leader. Students said, "This workshop allowed me to discover more about who I am and how I operate, what I bring to the table in the team and in the leadership setting. Medical school provides us with the knowledge required to become a physician, but does not provide us with the training to be an effective leader, and this program started to arm us with the skills to do that." I think even more importantly, it gave them the skills and some of the insights to be a leader, a near-peer guide. I will work on identifying strengths of each member of my team, try to figure out how to the best communication method for each individual. In my interactions from now on, I will now have a toolbox of communication tools. And I think really interesting, something we didn't expect, is students walked away with a different understanding of how they can interact with patients. And that's really what we're training students to do in medical school. We had one student say, "I learned that knowing how I lead and understanding how to look for others, for how others lead, will help me to relate to patients and colleagues in a more genuine way." And so this ability to arm students with their qualities to be a leader for themselves and for their peers also spilled into some of their clinical work, which was a neat perk. We were able to leverage a near-peer mentoring program that exists at many medical schools to provide low-hanging fruit to early career development for medical students. It was feasible, well received by students, facilitated training on communication, and integrated into the existing structure of this Navigating Medical School course. Ooh, the party started. I'm going to hurry and finish this last slide. That's the cue. There's about to be something to pull me off. So we have a bunch of unique challenges in North Carolina for developing physicians, for retaining physicians. And this is one opportunity. We hope this type of early leadership development can excite students about the things going on in North Carolina and retain some of those students for residency and future practice. We hope to expand this to interprofessional settings. I see Alicia sitting across the way, and she's going to ask whether PAs were involved. Our next session of this course, which starts on Saturday, if you want to come, Saturday morning, 8 a.m., we kick off year 2. We will have 24 medical students, 7 PAs, 4 CRNAs, and 2 PharmDs. And we hope to build an interprofessional environment for early leadership development for students and potentially to expand across the state and look at some of the regional variations in care we provide and start to train students early on understanding regional variations in care and leadership development. So thanks for listening. Happy to take any questions, and we'll get to the party.